Professor Finn here. We are back with Chapter 16, General Body Considerations. So, age. Kind of a no-brainer. How old the person is going to play a major factor you're going to do with an embalming analysis. So we can think of extremes, young and old, but there are four general categories the book separates people into. Infants, birth to age 4, child to young adult, 4 to 12, young adult to adult, 12 to the mid-70s, and old age, 70s to late 90s or even older than that. Age presents not only certain embalming difficulties, but difficulties specific to age groups. Obviously, we present in children differently than adults and elderly. Do not stereotype. Careful analysis allows you to choose techniques and chemicals that are appropriate for each individual circumstance. So just because someone is 12 does not mean that you need to treat them as adults, depending on what you see. You might have to do something a little bit different. Let the case tell you what you need to do. So infants and children, and this is later in the chapter. I'm kind of pulling things in a logical order to make it, more linear and make a bit more sense for you. So a fetus, okay, premature, born prior to the 37th week of gestation or less than 5.5 pounds. And this is different than a stillborn, which dies prior to delivery. That is an important differentiation because if a fetus is premature, in many states that is one type of death certificate, usually an adult death certificate. A person was born and a person died. If it's stillborn, at least in Florida, that requires a completely separate type of death certificate. Usually that's in Florida it's 2 legal-sized pages, a lot more information than what is collected on an adult, and also more areas on the infant death certificate are covered under privacy laws. So be aware that this is an important distinction. Infant age bracket is birth to 18 months. So even if they're premature, the infant would be birth to 18 months. Toddlers are 18 to 48. And we now look at body composition. This is important. This is huge as to why we kind of do things and judge different age brackets accordingly. But like the book says, avoid the stereotype. You might need to change things up. But generally, infants, 75% body water at birth. That decreases to 60% at 1 year. And then 12% body fat at birth, which increases to 30% body fat at 1 year. Specific conditions. Skin is fragile, swells easily. Vessels are tiny, but usually free of scarring. Usually they're autopsied. Disease can bring about buildup of waste in tissues, hepatic or renal failure, which usually means jaundice, discolorations you're going to have to treat. Pre-injection is not recommended on infants because they're already full of water. They're 70% water. This is kind of a no-brainer. Do not require as much volume of solution, but require the same strength. So obviously we're not going to inject an infant with 3 gallons of fluid unless we have a pretty good reason why we need to do that. So keeping it at the 2%, that would be important. Okay, that would be important because whatever we're going to put in is going to be further diluted by the more water that the infant body has. 3 categories of body, kind of a no-brainer: autopsied, unautopsied, and partial autopsy. Everything here is kind of normal, okay? Everything here is nothing different. Topical disinfection, leave IVs in place, take out anything that affects features, okay? Place an infant on a towel to help with positioning, also so the infant doesn't slide around the table, and the towel stays there the entire time you embalm. You're going to have to cut caps. You might have to use glue to seal the lids. There's plenty of things you need to do. Make sure you cover the eye caps with massage cream if desired. Ensure the cream is away from the eyelid margins prior to gluing because you do not want the glue reacting with the massage cream and being nasty. Muscular suture can be used. Needle injector is not recommended, generally because there's no bone for the needle injector to actually use. Some embalmers prefer gluing the mouth only. Some communities want the mouth to be left naturally open. Check with your local practitioner, and your practitioner will tell you how things are supposed to be done. If mouth is to be left open, make sure you clean inside massage cream accordingly. Massage cream can assist in mouth closure, okay? So yeah, you can put a little bit of massage cream on the lips, push the lips shut, and they'll kind of hold themselves in place. You'd be surprised how well that works. A wax restoration to ensure proper line of closure may be necessary. Infants, positioning varies, but generally, arms are at the side, forearms and hands are over the trunk, barely touching as if they're holding something. Head can be placed on the right cheek or head slightly turned. Legs are usually viewed. Use strips of sheeting to straighten them during embalming, as when you inject in. When they firm, they usually firm very well. Blood vessels, you can try to get the common carotid. Place support under the shoulders to help push that head back so it raises more anteriorly. Turn the head in the opposite direction of the vessel being raised, again, in an effort to pull it as close to the surface as possible. And try to hide the incision in a neck wrinkle. So you might have to, deviate from your normal plan of making something parallel, which goes up and down on the neck, and do something horizontal so that you can hide it better. Femoral, same incision. Inject down first, just like an adult. And then for drainage, use femoral vein or jugular. Axillary, not recommended. If you're going to have to go up into that area, use a subclavian. Abdominal aorta. This is usually ideal, especially on premature. The abdominal aorta basically rests right on top of the spine, which means you're going to have to work your way to it. So you make your incision just left of the midline, 2 to 3 inches long. You're going to have to pull out some intestines so you can access it. Inject distally, which means towards the feet, okay? And if the viscera starts to expand, you might have to open that up to let out some of the pressure. I've not seen that. I've not had to worry about that too often. Ascending aorta, drainage usually taken via tap. You make the incision down the midline of the sternum. Ossification has not occurred in the infant, so it's not really an issue. There's a second incision there you should review as well. You should probably use some retractors to hold everything open, and once the chest is open, you're going to have to cut open the pericardium to access the heart and the vessels. You may need to start clamping some things off. This technique may result in people wondering if an autopsy was done, so make sure that you might get permission for this, and make sure you note on the embalming report the condition of the remains as you receive them so that they don't think an autopsy was done. You're probably best served by going down to the abdominal aorta. Definitely want to see what type of clothing the family is going to bring in, no matter what. Cavity treatment, infant trocar, not break out the big guy. Standard point of entry, normal cavity fluid, close with trocar button or suture, and reaspiration is recommended. That way you can get any fluids that build up. Usually it's very time consuming because you're taking your time, areas not embalmed, arterially need to be hypodermically injected, and generally sometimes the infants are just too small. So we're having to actually really improvise by using hypodermic syringes with arterial fluid and injecting what we can. And don't be afraid to do that. Sometimes you might have to MacGyver it, get in there and use a hypodermic needle with a syringe, do your injection. It's the only thing that fits. And that's one of the reasons why I'm so good at this particular type of case, is because I'm not afraid to do that. We're going to talk more about autopsies in another chapter, so I'm not going to spend a lot of time here. Viscera may or may not be returned with the body. That's an important thing to note because people get really upset when things are missing. And if things are missing, you might want to inquire before you receive the remains officially, where things are at so that you know and have it notated on the documentation. Vessel selection is usually whatever you can find at this point. When an autopsy is done, it's, go in there and get what you can. Ligation may not be possible. You might have to use hemostats to clamp off areas. Place cavity fluid soaked cotton inside the mouth and under eyelids if necessary to help things out. Nothing that we wouldn't do for an adult. If you have to hypo with an arterial fluid, use a fluid with as little dye as possible. Now, this needs to be differentiated from what I talked about earlier, which was an arterial injection using the hypodermic needle and syringe as your injection machine. If you are going to hypo, where you just go in and treat basically hypodermically the skin directly, channeling and whatnot, you do not want something with a lot of active dye because it's going to look blotchy and disgusting. If you are going to inject with arterial tubes, clean them. Okay, infant arterial tubes are very, very, very small, so make sure that before you store them that there is nothing inside. So blow some water through it, make sure the stream is nice and clear, and then store them. You can even use a venous catheter if you needed to as an arterial tube. Do not skimp on chemical strength just because they're infants. Again, they have a high water percentage. Water promotes decomposition. So you might have to do the standard 2%, maybe even a little bit higher in some cases, if needs be, especially if they have something like a jaundice condition. Supplemental chemicals may need to relieve harshness. So if you are going to use something that's a fast firming, speak to your chemical reps. They can usually recommend a supplemental that takes that fast firming edge off but retains the high index. Generally, that is a humectant chemical, which is something you really don't want to add unless you have to, something like this, because of the water retention factor. You do want to add a little bit of dye for coloration, but again, be careful. A lot of the modern fluids have dyes already in them, so the addition of more dye might be a little bit of an overkill. Embalm legs before anything else to test fluid. As with any autopsies you will see in the upcoming chapters, you always shoot the legs first to see how the fluid reacts before you take it anywhere else. Generally, half gallon to 3/4 of a gallon of solution should be injected with 6 to 10 ounces of arterial fluid ranging from 18 to 25 index. So we see that that's probably medium index fluid in just about under a gallon of solution. Hypo from inside. That way, if you're making holes, the holes will leak inside the body. Close punctures with super glue in hidden areas if you have punctures on the external part of the body. And it says if you are going to hit the elbows or the antecubital fossa, which is the inside of the elbow, make sure that you're doing it from the inside of the elbow. So when you close the arm, it hides the hole. Inlays can be used to pack abdomen. Inlays are surface packs made of sheeting or cotton strips. Make sure you have notated what has happened with the internal organs if you do not have them, because just packing someone with cotton strips or sheeting can get you in trouble if you do not know where the internal organs are. Definitely paint everything with gels, and you're going to read a lot more about this stuff in the next chapter, I think, when we talk about autopsied bodies. And treat it just like an adult. Do not do anything different. Trunk walls need to be hypodermically injected, etc. Viscera can be treated like an adult. You'll see, again, we'll talk more about that in the appropriate chapter. Cutting viscera will allow better diffusion of cavity chemical. And just grab yourself a nice sharp pair of pointy tip scissors, go in there and snip some things rather than taking a scalpel and hacking indiscriminately. I just prefer the scissors. Nothing wrong with the scalpel, but I do think the scissors are better for you. If not using cotton to pack the cranium, ensure the cotton does not come into contact. If you are using cotton, is a drying agent, and if you put it in contact with infant skin, it will dehydrate it. So if you're going to use cotton, make sure you coat it with massage cream so it does not wick away the moisture and desiccate tissue. Suture ligature or dental floss. Start on the right, work on the left. Same as an adult, using an inversion suture or worm suture. Generally, you know, what I've seen most people do with infants is super glue. Baseball stitch can be used using dental floss. I know a lot of people who embalm who prefer dental floss on infants. So again, I'd probably keep a pack around the prep room just for this use. If you did have some ossification, so the cartilage in the cranium and calvarium has started to turn to bone, adult procedures can be utilized, which you'll learn about in a separate chapter. If the temporalis muscle has been removed, you're going to have to fill it with some putty. Tissue building does not unless there is some muscle or tissue there for it to basically bond and fill to. If you have bone, cow clamps can work, or you can use the drill and wire method, which I do not particularly prefer in the grand scheme of things, but it does work. Suturing of the abdomen starts at the bottom, works its way upward, same as an adult. So with the preemie, start with typical procedures, carotid or aorta for injection. Remember, largest one possible. Aspirate and inject. External compresses are the easiest. Wrap in saturated cotton. Now, if you're going to wrap in saturated cotton, usually this produces an unviewable case. So if you are intending to view the premature infant, you wish to be very, very careful about wrapping something in saturated cotton. You could also do just good old-fashioned hypodermic injection. Want to be very clear about this, slide number 35. It is your professional responsibility that if a family wishes to view an infant, to do the best you can to allow that to happen. I know a lot of people who instantly say, oh, premature, non-viewable, and then just wrap it in the compresses with saturated cotton, wrap it in plastic, put it in the container for interment or cremation, and away it goes. I will agree that there are some times where that might be the case. depending on the level of gestation. But if you have a premature infant that you can actually raise vessels on, you should not be knee-jerking, going immediately to the compress and saying to someone, it is unviewable. That is a liability issue, okay? Especially if you haven't even seen the remains at that point. So 4 to 12-year-olds, okay, child, okay, body size may cause complications, but there are generally no special techniques to be considered, like the infant or toddler. We basically go to our everyday items. The axillary is not recommended simply because, again, size issue. Many of the children this age are usually autopsied as a result of their cause of death, so protocols for autopsies are not uncommon. Some people argue that femoral is the best choice simply due to types of clothing for children where carotid incision would be visible. And if they've been autopsied, just use what you can find. If they haven't been autopsied, try to find out what they're going to wear so that you can accommodate the family accordingly. Trauma to the face will cause swelling, and yeah, that's nothing new for us. So restricted cervical injection should be utilized in anything to do with facial trauma. And again, you should not have sclerosis in this age group. Young children up to the age of 12, even to 15, 16, should not evidence sclerosis generally. Medium index, 18 to 25, are recommended. Skin is more delicate than an adult. And also at this point, we do not have the moisture issues that we had with infants. So the fluid is not going to be further diluted more extensively than you would as an infant. So if we just go ahead and we reach for the 18 to 22 index, we should be pretty good. The 25 would be fine. I'd probably stay away from fast firming or something like that, or something that super dehydrates, because we don't want that with a child. Again, that's personal preference more than it is test material. That is just for your own benefit. You can either use one fluid mix throughout the whole embalming or start weaker and go stronger once the scolorations are removed, which is something you can do in an adult. Supplemental chemicals can be used, but dyes should be used minimally. You want as natural of appearance as possible, and I've said it before, I say it in a lot of my lectures here, a lot of the modern fluids have dyes already. So you'd be surprised how much they will dye the body without you adding extra. In the event of jaundice, renal hepatic failure, obviously you're going to have to use the solutions appropriate for that. So counter staining, jaundice fluid, whatever you're going to do it. Amount of solution is greater than infants, but lower than adults. They're larger than the baby, so you're probably going to need more than half a gallon, 3/4 of a gallon, but you probably still are not going to need a full 3 gallons of something. This age group is more susceptible to bacterial and viral diseases. They're kids. They're outside. They're playing, doing all sorts of crazy stuff. So ensure disinfection and cavity treatment is thorough. And you know the drill. Go back, re-aspirate, and re-inject if you think for a second there's any problem. And pay attention to your pressures and rate of flows. Arm position tends to be more relaxed and straighter than that of an adult. I've usually seen kids in this age bracket with their arms straight down the sides of their body. But again, how you do something locally, your funeral home that you work for will tell you. Facial hair should be shaved for best cosmetic display. Facial hair is called lanugo. Sharp razor with shaving lather is good. Do not shave the forehead. You just need to make sure that the lower face is okay. Mouth closure can be a bit of an issue, so review procedures for buck teeth, lip considerations, just the general stuff you already do for adults. So adolescents and adults, realistically, this is business as normal. Obviously, most of the textbook is dedicated to this, so I'm not going to spend a lot of time on it. I give you the bullet points. Big thing is age alone cannot be the single factor to determine solution strength and volume. Your entire book is basically pounding this into your head. The age by itself gives you hints of what you need to do. We learn the general category rules. Infants have more water, need slightly higher strength solutions, etc. But you need to look at your case and figure out what's going on. For all body types, manufacturers' recommendations with textbook practices, and even your own experience should result in adequate preservation. If you've adequately preserved the body so it does not decompose or putrefy, then you should not be having issues, because you should be explaining to your families things that can happen as a result of jaundice, etc. So full disclosure is a good idea. Start with weaker solution to establish distribution. Work stronger later if you have to. Increase solution by adding more of the same chemical or adding a stronger chemical. We get some numbers for the first time here, I think. Ideal rate of flow in a normal case is 10 to 15 minutes per gallon, pressure setting between 5 and 20 pounds. Now, do the math. If you are in an embalming room and you are injecting 3 gallons of solution, you're probably going to be in there, according to your book, for 45 minutes. So if you've injected a full body in 30 minutes, according to your book, you might have done this too fast. Be aware of that. Pressure settings, 5 to 20 pounds are common. Again, different people, different things. Your pressure setting will largely be a matter of your preference, or if you have one of the more modern machines that are more expensive, your pressure is removed. It's an automatic sensor. So in which case you're only paying attention to rate of flow. Initial rate of flow should always be slow. You do not want to blow clots and block things later on. Build up speed later. If you inject with a high rate of flow to establish side pressure, arterial side pressure, it's best to use concurrent drainage so that things don't swell. So old people, elderly, age bracket to which I am rapidly arriving. Average life expectancy for men is about 75.2 years, and women, you get an extra 5 years. Drug therapy can cause complications outside typical conditions associated with age. Arthritis causes positioning problems where you have to fix those sort of things using outside methods. It's usually impossible to open arthritic fingers, might have to cut tendons and muscle. I mean, things can get messy. Generally for elderly, common carotid is a preferred site because even if they do have sclerosis, it's usually not evident much here. Femoral is usually bad. You might have to try to go to a popliteal. Again, personal preferences. The last resort, reach for the hypovalve trocar and shoot the legs. Cachexia emaciation may cause closure problems, so be aware of this. Atrophy of bones may cause you to have to use suturing rather than needle injectors. One of the reasons why in my embalming labs, especially when I'm teaching them, my students probably never actually touch a needle injector while they're in school. They learn sutures because sutures work every single time, and the needle injector may or may not be used depending on a variety of situations. So being proficient with suturing features is a must for me. Sclerosis of the arteries can sometimes be felt in an emaciated person. That immediately relieves you of the need to have to make a cut. Be prepared to sexually embalm. Poor circulation can lead to sores and lesions. Treat them. Disinfect them and treat them accordingly. Purpura cannot be cleared. It's a bruise. It's extravascular. So you're going to be using surface packs and hypo injections, which will help preserve things, maybe even help bleach a little bit, but they will not always clear out. They might lighten up, but they're never going to go away. Purpura may even swell because it's a rupture. It's capillaries. It's a bruise. So you might see some minute swelling or some major swelling. Broken skin should be removed at the beginning of the embalming. Surface packs apply to dry things out. If there's a malignancy, a tumor of some sort, all sorts of bad things happen. So there's various chapters dedicated to those, which you will learn about. Biggest problem with any malignancy is buildup of wastes. Usually because of the fact that that counteracts the preservative. More stuff to have to preserve, and away it goes. Cause of death is usually not attributed directly to the malignancy, but due to complications involving it. Yeah, cancer causes you not to eat, so you waste away, and the drugs kill you. That sort of gig. Cardiac death can result in severe edema and swelling and all sorts of stuff. So be aware that you're going to be using specialty fluids and specialty techniques regarding water storage in the body as well as swelling. And there, again, there's a whole chapter dedicated to that. Diabetes and diabetic drugs cause plenty of complications, as evidenced in chapter 23, which we will get to. Principal manifestations of diabetes include hyperglycemia, glycosuria, ketosis. So excess sugar in the blood, that's what it says, hyperglycemic, more sugar. Glycose, urea, sugar in the urine. And ketosis, memorize that one. Ketones in the blood and body tissues. Acidosis, so there's your SIS portion of it. And then ketone that's in the name as well. Pathologic changes due to diabetes. So disease changes due to diabetes cause problems. The big one there is gangrene. Use of high index fluids is common along with restricted cervical injections. And again, there are methods for treating jaundice and that sort of stuff down the pike. Your book summarizes diabetic embalming. I'm just going to kind of put it all up here for you. Carotids, strong solutions, dyes as tracers. And you might, now mind you, this is diabetes. This is not jaundice. Just because the two are commonly associated, do not fall into the trap that immediately says, oh, they got diabetes, I have to counterstain. No, that is a fallacy. Do not do that. Diabetes by itself might have sclerosis, so use carotids. If it's sclerotic, you probably want to use strong solutions to help with some of the waste buildups, and whatever does get to where it has to go needs to do the work of double. Dyes to let you know that it got somewhere. Some massage to stimulate distribution. You might have to worry about respiratory fungal infections. You're going to be spraying stuff down the throat, which you should be doing anyways, as well as proper aspiration and injection of cavity chemical. Hypo and surface packs where distribution don't work. And cavity immediately to take care of the stuff that's going on in the lungs. Folks, thank you for your attention. We'll see you next time.